And so I think it goes back fundamentally to just asking the question, how do we know these clocks are effective and what we want them to do? And what we really want them to do is to capture age-related risk, right? We want to capture that process that is the number one risk factor for every chronic disease and death. And so as these clocks start to gather more information, they should be more predictive for different types of outcomes. And so that's one of the big things that we've shown with this clock is that it's really the most predictive of every type of age-related outcome. That means that generally, if you're accelerated with this biological clock, you're going to be more at risk of all negative outcomes than you would be if you were accelerated with the same differential, let's say 1 year, than any other clock in the process. So by basically saying if you're accelerated or decelerated, we have a better connection to disease. And that's really, at the end of the day, what we want to do so that we can change this metric and then change that risk of disease. So really, doing preventative medicine type measurements to quantify that biggest risk factor and turn back our aging systems.
Right. And that the last few sentences that you described are really exciting and something we'll converge in on after a few more questions here. And the other thing that I want to go back to, in addition to this omic part of the clock name, which is giving us all this rich source of information into the predictive algorithm, is that we also have M in there, and that stands for methylation. And this clock and this work comes from a broader collaboration that is actually really impressive. And you've pulled in some of the best researchers on this topic in the world. And I would like to just briefly hear from you about that collaboration. And there's a lot of people to mention, but if you could keep it fairly simple, mention the institutions and maybe lead researchers who are working with you on this and why that's so significant.
Yeah, definitely. So one of the things about proving those outcomes, right, to make those claims we just talked about longevity and relationship to disease, one of the most important things is that we actually have outcome data. We actually know what happens to those patients. And that's really hard data to come by because you basically have to follow patients for 40, 50 years to see what's happening to them. Are they developing disease? Are they dying? And when are they dying? And what are they dying of? And so all that information is incredibly important, but also incredibly difficult to get because really you had to start a lot of these studies or these data collections a long time ago. And so really, in order to do that type of analysis, which we know we needed, we had to work with a biobank. And so we chose to work with Brigham Women's Hospital and Partners Biobank and sort of the Harvard collaboration team. And so Dr. Jessica Lasky-Sue is our main collaborator on this with one of her postdoctorate students, Ching Wen. They are sort of our number one collaborators in this from conception to sort of development. But through the biobank, we were actually able to get samples that had been taken 50 to 40 years ago, and then do our analysis on those samples. And I think to your point about explaining the methylation, that's really what we knew we wanted to do. We knew that biological aging is very complex, but to measure all of those different portions of individuals aging is also prohibitively expensive.